John, it's good to see you. Congratulations, I hear it's your 6-month anniversary.
Thanks, Karen. It's been tough, but with your help and the AA meetings, I'm beginning to feel okay.
That's great. That's really great. It seems as though you're becoming more and more comfortable with your sobriety. If it's okay, I would like to talk with you about your smoking. How do you feel about that?
Yeah, it's okay we talk about it. I know you brought it up when we started my treatment plan, but I still don't get it. What's smoking got to do with me staying sober?
That's a good question. There's more and more evidence to suggest that quitting smoking actually increases your chances of staying sober.
Why is that?
Well, first of all, you've already told me that, like most smokers who drink, you link the two behaviors, so they sort of go hand in hand. Doing one can prompt you to do the other. The association is pretty strong for you, so smoking can unconsciously trigger you to want to have a drink, even after you've stayed sober for months.
Well, that sort of makes sense. I never thought about that.
The behaviors are interlinked, and you're still using a drug to deal with life instead of drawing on your internal resources or your family and friends.
So you're saying that whether I'm using alcohol or nicotine, it's almost the same.
Yes, in many respects.
But I've given up everything else in my life. If I stop smoking, there'll be nothing left.
Smoking has been an important part of your life, and it's been an important part of your life for a very long time. But what do you think the benefits might be from quitting?
I guess better health, save some money. I know a lot of people that would be glad I quit.
Exactly.
But wouldn't the stress of quitting increase the chances of my starting to drink again?
If we set up the quit plan properly, we will be able to deal with that. And there really is no evidence to suggest that quitting makes individuals relapse back to drinking. It's actually the exact opposite. Quitting increases your chances of staying sober.
So how do we do this so that there aren't any problems?
The best approach is to address both the physical dependence on nicotine with a medication, as well as the routine of smoking by participating in a quit smoking program or meeting individually with a smoking cessation counselor.
I didn't know that.
Just like you did when you were drinking, you need as much support as you can get. I can be here to help, as well as your sponsor and your AA group. And I would like to suggest that you start going to non-smoking AA meetings.
Yeah, I remember when I first started going, someone mentioned they were quitting smoking.
Yes, they can be extra support as well, but it's important for you to get into a program specifically designed to quit smoking. That way they can teach you how to deal with all your triggers to smoke without having to have a cigarette.
And those cessation medications really work?
Absolutely. They significantly reduce or completely eradicate irritability, anxiousness, and other withdrawal symptoms that lead many people back to smoking. You'll use the medication for 8 to 10 weeks, which will give you enough time to comfortably address the behavior modification necessary for you to stay quit permanently.
My father had his first heart attack when he was my age, and I've always been concerned about a higher risk rate because I'm a smoker. My doctor has told me that for years. Okay. Let's start to give this some serious thought.
Please do. Now, what do you think about discussing this at our next visit?
That sounds good. I really appreciate the information and the fact that you're not lecturing me about this like so many other people do.